Thank you. My name is Bella. I work at Sage Nursing Home about 2 years. I'm here today to talk about zero COVID strategy for care homes. And at the beginning of the pandemic, we don't receive the proper PPE. In my case, to make sure we had the minimum protection, I started making homemade my face shield with an elastic for my leggings, like that. And then with laminated paper, and I shared it between my colleagues to try make sure we had at least some protection. During this time, I was so angry about the conditions and lack of protection on top of the issue with pay. I asked my colleague, and we were talking, and we decided to join with the union, UVW. The reason I'm here today speaking to you is because today my colleagues are on strike. Sadly, I no longer work there because I have a number of issues, and some of which I'm going to speak about today, but I am here supporting my colleagues at SAGE and the strike action. They are asking for £12 an hour, proper sick pay, and annual leave in line with the NHS and trade union recognition. I'm talking about respect, dignity, and equality. Zero COVID strategy in care homes. Basically, we had people working incredibly hard without the proper conditions, and a lot of care workers across the country have spoken with a national network. So what are some of the issues? First of all is PPE. We know this is improved now in a lot of care homes, but we have to make sure the standards is maintained and have the proper provisions and proper guidelines in place, standard maintaining to try and reduce the risk of spreading the virus. We need to make sure the care workers have proper sick pay as with the NHS. In a lot of care homes, we only get the statutory sick pay, which means we only get £95 a week and excluded the first 3 days. We can't live on that. I know from my experience at SAGE, my colleagues suspected they went to work with the virus, but they couldn't isolate. They couldn't take time off work because they couldn't afford to pay the bills. So how many lives will we have saved if they had full sick pay from the beginning of the pandemic? We know the government introduced a scheme. They gave money to council to the care homes, but a lot of care homes have necessarily applied for this to cover sick pay. But in the case of SAGE nursing home, it was only after a union ask. The management ignored us, but we had support of the union. That happened after the first wave. That means the situation put residents in risk and even the staff, and the sick pay is only for coronavirus, but we need to make sure this is extended because we're talking about zero COVID strategy. We need to talk about how contain viruses and avoid spreading the infection, especially in health and care settings. And
that's wrap up for us now.
This is just a few things about the testing and rules in the care homes, and about the sometimes it's not enough staff. And another thing is about to have a health and safety represent. It's very important. That happens if you have you recognize the union. At the end, I just want to say I asking for support for the colleagues at SAGE. They need all support. Please donate to the strike fund, write to SAGE, and support the right standard in the care sector. We will win. Thank you very much.